Depression is more than just feeling sad. It's a serious medical condition. It affects how you feel, think, and act. Depression can happen to anyone. It's important to understand depression so we can help ourselves and others.
Many people experience depression. It impacts their work, relationships, and overall well-being. It's crucial to remember that depression is treatable. With the right help, people can get better. Doctors use a comprehensive manual called the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, to diagnose a wide range of mental health disorders. The DSM-5 meticulously lists specific symptoms and criteria for various conditions, including major depressive disorder, commonly referred to as MDD. To be diagnosed with MDD, an individual must exhibit several of these symptoms consistently for a minimum duration of 2 weeks. One of the primary symptoms is experiencing a pervasive feeling of sadness or hopelessness most of the day, nearly every day. Another significant indicator is a marked loss of interest or pleasure in activities that were once enjoyable or fulfilling. Additionally, changes in appetite, whether it be a significant increase or decrease, along with disturbances in sleep patterns and energy levels, are common symptoms. Other notable symptoms include difficulty concentrating or making decisions, persistent feelings of worthlessness or excessive guilt, and, in more severe cases, recurrent thoughts of death or suicide, which require immediate attention and intervention. These symptoms collectively cause significant distress or impairment in various aspects of an individual's life, including personal, social, and occupational functioning. Sometimes other conditions can look like depression. These conditions can mimic the symptoms of depression, making it challenging to identify the true cause of the distress. This is why it's important to rule them out. A thorough evaluation by a healthcare professional is crucial to ensure an accurate diagnosis. Thyroid problems, for example, can cause similar symptoms. Hypothyroidism, in particular, can lead to fatigue, weight gain, and mood changes that resemble depression. Certain medications can also lead to depression-like side effects. It's essential to review any medications you're taking with your doctor to determine if they could be contributing to your symptoms.
A doctor will consider these factors. They will take a comprehensive medical history and may order tests to rule out other conditions. They'll make sure it's truly depression and not something else. This careful approach helps in providing the right treatment and support. Another example is grief after a loss. Grieving is a natural process that can be intense and overwhelming. Grief can be very painful. It can cause deep sadness, crying, and a sense of emptiness. It might share features with depression. However, the context of the loss is key in differentiating between the two. However, it's a normal reaction to loss. Grief is a process that most people go through after losing someone close. It doesn't necessarily mean someone has MDD. Understanding the difference can help in seeking the appropriate help and support.
Section 4. Depression's different faces, men, women, and children. Depression can show up differently in different people.
Men might be more likely to get angry or irritable. They may engage in risky behavior.
Women, on the other hand, might experience more sadness and guilt. They may also have physical symptoms like headaches or fatigue.
Children with depression may seem withdrawn or clingy. They might have trouble in school. It's important to pay attention to these changes. Early intervention is key.
Section 5. Finding help now, crisis, resources, and support. In this section, we will explore the various resources available to you or your loved ones during a crisis. If you or someone you know is in crisis, please reach out for help. It's important to know that there are people and services ready to assist you.
The 988 Suicide and Crisis Lifeline is available 24/7. This lifeline provides immediate support and connects you with professionals who can help. You can call or text 988 to connect with trained counselors. These counselors are experienced in handling crisis situations and can offer the support you need. The Crisis Text Line is another great resource. It offers a convenient way to get help through text messaging. Text HOME to 741-741 anytime, anywhere. This service is available around the clock and provides confidential support. These services provide confidential support during difficult times. Remember, you're not alone. There are people who care and want to help you through this. Depression is treatable and help is available. Speaking to a mental health professional can make a significant difference in your well-being. Don't hesitate to reach out for the support you need. Whether it's through a phone call, text message, or speaking to a professional, taking that first step can lead to a path of recovery and hope.